notice that you experience dizziness during certain weather conditions? Maybe if it's overcast or cloudy or rainy, or if there's a dramatic change in temperature or barometric pressure, that all of a sudden you wake up with dizziness or you experience an episode of dizziness or vertigo? That's a common problem that I ask all of my patients about when I do their initial evaluation, and I actually experience myself. So we're going to talk about that in today's video. But first, I'm the Vertigo Detective. I'm Dr. Kim Bell. I'm a doctor of physical therapy, and I help patients with dizziness and vertigo in San Diego, California. This channel exists to offer education, information, and hope to those of you that I cannot work with in person. But please keep in mind, this is not individual medical advice. I recently wrote a blog on dizziness or vertigo affected by weather, and I thought this is a good topic to share on this channel, because if you notice that you have dizziness or vertigo when there's a dramatic change in temperature, which is barometric pressure related. For example, where we live in California, Southern California, there are Santa Ana winds, and when those hit, that can cause dizziness or vertigo for some of my patients. Certain overcast conditions, cloudy conditions, rain, all these kind of things. Now, I'm not talking about depression. So just to clarify, if you're feeling sad or depressed because of the weather, that's a separate topic, and I encourage you to talk to your doctor about that. But what I'm talking about is people who experience dizziness or vertigo related to the weather. So there's two main things in my experience that can cause dizziness or vertigo from certain weather conditions, and that would be vestibular migraines or traditional migraines. So any kind of a migraine event that can include dizziness or vertigo, maybe nausea, maybe imbalance, and then BPPV. So migraines can be triggered by weather. A traditional migraine is going to have throbbing, severe pain, usually on one side of your head, and it can last anywhere from 5 minutes, say, to 72 hours. And it can include dizziness, vertigo, nausea, imbalance, sometimes vomiting, and other neurological symptoms. The neurological symptoms that might come with a migraine vary person to person and one event to the next. However, you can also have what are called vestibular migraines, which are migraine events that don't necessarily come with a headache. So these are pain-free episodes of dizziness or vertigo that can include nausea, imbalance, baseline dizziness, motion-activated dizziness, and those I typically will say to my patients, how can you tell if you're having a vestibular migraine? It goes undetected a lot, especially if you don't have a headache. And the way that I work with my patients on this is I say, look, if you are all of a sudden sensitive to light, or you're all of a sudden noticing things are really loud, like you can hear the refrigerator running, you can hear the fish tank bubbling, you can hear the dog barking from all the way down the street. So things that you normally would not be able to hear, all of a sudden now you can hear them and they're bothersome to you. They actually make you feel more dizzy. Or you're very sensitive to smells. So for example, if I have a vestibular migraine, I can smell the kitchen trash 2 rooms away, and I have to ask my husband to take the trash out, and he says, how can you smell it from that far away? And I said, I just can. Okay, so if you have an episode of dizziness or vertigo that's related to overcast weather or a big change in barometric pressure, and you notice you don't necessarily have a headache, but you notice that you have a heightened sense of smell, you have more sensitivity to certain sounds, and or you're more sensitive to light and certain visual triggers during this episode, and then that goes away when the episode of dizziness or vertigo resolves, then you may have experienced a migraine or a vestibular migraine. So what do we do with that? I personally treat that like a regular migraine. So you could try to go to sleep, right? Try to sleep it off. Maybe put an ice pack on your neck, put a hot water bottle on your neck, put an ice pack on your head, maybe a hot water bottle on your belly. Maybe you take some medication for migraine, either over the counter or prescription. Your doctor can advise you on that. And I have blogs actually on strategies to deal with migraines and even cervical dizziness. That's a very specific topic. I'll shoot another video on that another time, but that would be the vestibular migraine, which is a commonly triggered cause of dizziness or vertigo from weather. The second one, and this one is really important to understand, is that changes in barometric pressure can be associated with a new onset of BPPV. That's the crystals in the ears coming loose. So this is sort of a mind blower because it's like, well, how does that exactly work? Well, we have a research study that does associate a new onset of BPPV with changes in barometric pressure. So for us here in Southern California, that would be like when the Santa Ana winds come through. It's a hot wind. So all of a sudden it gets hot out. It's really windy. There's a big change in the pressure system. And I typically wake up with BPPV in both ears. So my right ear and my left ear, and I usually wake up with a migraine or a vestibular migraine. And so I know, I don't even have to check the weather, and I know we're probably having Santa Ana winds. I have a handful of patients, probably less than 10 patients, that have the same exact thing. So when the Santa Ana winds hit, they wake up with BPPV, that's the crystals loose in their ears, and they wake up with a migraine or a vestibular migraine. And so I work with them on how to deal with that because, of course, we cannot control the weather. And there's nothing we can really do to prevent the onset of the BPPV or the migraine when the weather's shift like that. And so we just have to be prepared to respond in a skillful way. So how do you know if you're having BPPV related to the weather? Well, typically you're going to feel it in the morning when you wake up, and it can cause spinning. If it's moderate to severe, you can feel a spinning feeling that should go away within a minute when you move around, like lying down in bed, rolling over in bed, getting out of bed, looking up, bending over, turning your head quickly. Those are all examples of things that can trigger a spin or a wave of dizziness or a wave of nausea from BPPV. The difference is the BPPV, it may not go away on its own. So the vestibular migraine or the migraine event triggered by weather, typically it's going to resolve on its own within 72 hours, even if you don't do any interventions. It's just hopefully going to go away unless you keep doing things that continue to trigger migraines, like drink alcohol or stay up late or be dehydrated or be stressed, things like that. So there are certain behaviors that you can do to continually trigger more migraines, and so then your migraine event may not necessarily go away on its own within 3 days. But if you're taking care of yourself and you're resting and you're hydrating and you're waiting it out and you're doing really good self-care, it should resolve on its own within 3 days, the migraine event, even though you could have a hangover afterwards. But the BPPV may not go away on its own. So even, days, weeks, months later, you still may be getting dizzy when you lie down in bed, roll over in bed, or get up out of bed. And so that's one way to kind of distinguish between BPPV and migraines related to weather. And then if you do have BPPV, which are the loose crystals in the ears, in my approach, in my opinion, as both a clinician and a patient, I would treat it with BPPV treatment maneuvers. These are called canalith repositioning maneuvers, CRM, and they are literally to reposition the crystals in your ears to move them back to where they came from by basically figuring out where they are and then reversing the course that they traveled to get there and putting them back where they belong in the ear. And so that would be BPPV treatment maneuvers, particle repositioning maneuvers. And that needs to be done by a vestibular healthcare provider, either a physical therapist or a doctor, somebody that specializes in vestibular treatments for BPPV. So I hope that was helpful. I actually have a blog on this topic, but I'm trying something new with this video, not reading the blog, and I don't know if you're going to like that better. In a lot of my other videos, I read the blog to you. So let me know in the comments, do you like it when I just talk off the cuff about something maybe I've already written a blog about, or would you like to see the blog and have me read it to you and expound upon it while I'm reading it to you? So just let me know in the comments. I hope that was helpful.